Over the past 2 to 3 decades, we've seen an increase in the duration of air travel. With that, we have an increased risk of developing blood clots in our lower limbs. Anytime we're stagnant, not moving, sitting in one place, our blood slows down. The blood return to our heart from our lower limbs slows down, and that increases our risk of developing blood clots, or DVTs, also known as deep vein thromboses. There are several things you can do while on a long distance flight that'll reduce your risk of developing blood clots. The first of which is the easiest one. Every 2 to 3 hours, you should get up, take a good stretch, walk around for a couple of minutes. That'll help to relieve the pressure on your lower limbs, get the blood flowing. The second thing you can do is keep well hydrated. Planes tend to be dry environments. We get dehydrated during the course of the flight, and that leads to increasing the sluggishness of our blood, thereby increasing the risk of developing blood clots. If you're able to take a glass of water every couple of hours, that'll help to keep you well hydrated. The third thing is wearing compression stockings or compression socks. Those are garments which keep a constant pressure on your lower limbs. They'll have you feeling better after the flight, and they'll reduce your risk of developing blood clots as you go along. One thing folks often want to do, certainly on transatlantic or trans-Pacific flights, is try to get some sleep to help with jet lag. While it might sound like a good idea on the surface, I tend to recommend against it. Sitting in, again, if you do fall asleep for 6 to 8 hours, that'll increase your risk of developing blood clots just from the fact of being in one position. If you're able to follow these few simple tips, it'll ensure that you have a safe trip and reduce your risk of developing blood clots along the way.